Gum disease is an inflammation around the gums, and in the beginning it starts very bleedy when you touch or when you brush, when you floss. This is caused by plaque. The plaque that stays in the tooth release toxins, the bacteria that are there release toxins in the gum, and the gums become inflamed. Over the time, this plaque goes down the tooth and starts to affect the bone, and the bone starts to shrink. If you leave it there for a long period, months and years, the gum shrinks, the bone shrinks, and the tooth becomes wobbly. And then in those cases, sometimes we need to take the tooth out. The stages for gum disease are usually, it starts as bleeding in the gums. Sometimes if the patient smokes, we don't have the bleeding, but then because if the plaque is here, imagine the gum is next to it, it irritates the gum, and the gum becomes inflamed. Over the weeks, this plaque starts to become harder and harder. When we have plaque in the tooth becomes more rough. As the surface is rough, it's even easier to accumulate more plaque. So tartar, the plaque that is hard, it starts to accumulate, and it starts here, and then eventually it goes here to the root. And then if you leave it there untreated, it goes here. It goes here in the middle of the roots. If it goes here, it's very hard to remove this tartar. The presence of the tartar, which is the plaque that is too hard, causes the shrinkage of the bone. And you need to think that the bone is like the foundation of the house. So if we have no foundation, the house is gonna... And it's the same thing with the teeth. Eventually, I've removed teeth that I could see tartar here. And when we have tartar so deep in the root, it's so hard to clean. We need to open the gum, we need to clean very well there. But once we put back the gum in place, you're not going to have bone again there. So you've lost all the bone. So that area is much more fragile. Fortunately, most of the cases, they stop as a bleeding. But if you leave this plaque for too long, it could affect the bone. To prevent gum disease, the first thing is at home. In the very beginning, you can treat with a good hygiene, a good flossing, good brushing. You need to remember brushing 2-3 times a day and flossing once a day. Could be using a flosser, a water flosser. You need to clean between the teeth. This is the most important. Second most important is having your routine checkups done by a dentist. What I see is that people, they don't like going to the dentist. They don't floss and brush correctly. And there is no one checking to see if there is any disease developing there. And the gum disease is a disease that is a silent disease. You don't know that you have until it's too late sometimes, until it's a severe gum disease. Most of the times, we start with something that is called deep clean. Deep clean is a special clean that is done. Usually it's half the mouth. We numb this half of the mouth, and then we do a very thorough clean. If the tartar is very easy to remove, it's not going to take too long, it's not going to hurt. We do a normal clean. Why I do this first? Because the next step is surgery. If the plaque is too deep, we need to go even deeper, because the deep clean, we don't remove the gum to see. Sometimes it's so deep that we need to remove the gum. We need to remove inflammatory tissue to help healing the area. In those cases we do a surgery. We open the gum, we clean very well, and then we close. Sometimes patients with gum disease, they go to the dentist and they think they treat the gum disease and that's it. They don't need to take care anymore. No. Patients with gum disease, they need regular maintenance done by the dentist. And they need to understand that this disease we can stop, but we can't make the bone grow back to where it was before. Once you've done the treatment for gum disease, you need to continue for your maintenance to keep everything clean. Otherwise, the disease is going to come back.